Chair. Mr. President, it is good to be back in the United States Senate after a brief absence due to some health issues. I'm enormously appreciative of the people of Massachusetts, all of their thoughts and good wishes and prayers that were extended to me. And I'm very thankful to so many of our colleagues this side of the aisle and on the other side as well that wish me well. Matter of fact, there were a number of those on the other side of the aisle that urged me to take even additional time, and the Senate could function very well without my presence. I appreciate their good thoughts, but we're back in business and ready to deal with the issues at hand. And one of the very important issues at hand is reminding the country of this extraordinary achievement and accomplishment by a magnificent sports team from my home city of Boston, Massachusetts. The country knows about it, but I know Senator Kerry joins with me in taking a moment to say how much we are cheering them on this magnificent, beautiful day in Boston. And our greatest regret is missing what they call the rolling rally that will celebrate the World Series victory of our beloved Red Sox, and it is going to be an absolute spectacular day in Boston. And both of us, Senator Kerry and I, are very grateful to the Senate for last night for passing this wonderful resolution that expressed all of our feelings about the Boston Red Sox and their success this year. Just an extraordinary record. And for the millions of members of the Red Sox nation, this year has been a dream come true. We're proud of the team, of what they've accomplished, especially the way they came back after trailing the Cleveland Indians by some 3 games to 1 in the American League, and they went on to win the 7 straight games. So it was an exciting season full of brilliant performances, but none of them were as touching as the extraordinary, and it was an extraordinary performance by John Lester, who was the great pitcher for the Boston Red Sox, who pitched 5 2/3 shutout innings in Game 4 on Sunday night, less than 1 year after being treated for lymphoma. And to thousands of families struggling with cancer, his example is really a true inspiration. And I want to congratulate the Colorado Rockies as well. They showed us what can be achieved when everyone pulls together, winning an incredible 21 out of their 22 games to reach the World Series and making history in the process. And I have no doubt that their team will have a brilliant future. So congratulations, Red Sox, for a job brilliantly done in 2007. Wonderful year for baseball in Boston. Enormously grateful to the whole team for an inspiring and an exciting season, and we look forward to another great year in 2008. Mr. President, I want to just add a brief word on this debate that is dealing with the Amtrak legislation. And as I make these comments about the Amtrak legislation, I remember very well a former colleague of ours who is not here, has his own particular health challenges, beloved figure, Senator Claiborne Pell of Rhode Island. Senator Claiborne Pell of Rhode Island, author of the Pell Grants, author of the National Endowment for the Arts, author of the National Endowment for the Humanities, author of the Seabed Treaty that did more in terms of arms control and the placement of weapons on the seabeds. There's a whole legacy there. But President Kennedy said during President Kennedy's presidency that as a student of history, it was extremely rare that any individual member of the Senate could come up with a new idea and then see a real down payment on that particular program. And this is the case with regards to Amtrak. Claiborne Pell was the first voice in terms of the rapid transportation between Boston and Washington. And he struggled for that program, and during the early 1960s, he was able to get some actually resources, not great amounts, but for the study of it, for the feasibility of it, and for building a sense of inevitability about it. And he saw long before others did about the importance of transportation, this rapid transportation for our nation as an energy saver, for the movements of people. He anticipated the congestion. So many of the other issues which have been talked about by two of our colleagues and friends, Senator Lautenberg and Senator Lott, who deserve a great commendation for this, for their efforts and for their leadership. We're reminded with the explosion of the cost of gasoline, congestion, environmental issues about the importance of this legislation. At many times over the period of the last 40-odd years, this legislation was at risk, but now it is well established, not only for the corridors which are highly populated, but we're seeing, as has been pointed out at other times during the debate, about other examples of this kind of rapid movement of individuals between various population centers and the difference that it has made and contribution it has made in terms of not only passenger service but also in terms of our economy and also in terms of the environment and the use of energy. So, Mr. President, I'll ask consent that my full statement in support of the legislation will be placed in the record.
Without objection, so ordered.
And, Mr. President, I want to make a comment on an issue which I've spoken about frequently over the period of the last 10 years, but one which I feel immensely strongly about, and that will be before the Senate and before on the national agenda in these next several hours, and to draw attention to its importance to our future of our nation, and particularly to the children of this nation. And I know there's been a good debate and a good discussion. I've spoken frequently about it, but I welcome the chance once more as Americans are beginning once again to refocus on this issue. It takes time. There are so many different issues that are before the Senate. It does take time. We have to repeat and come back to these issues. It doesn't surprise me. We've seen it at other times. I was here in 1964 when we failed to pass the Medicare program. I can remember the whole stream of our colleagues going down to the radio and television gallery, issuing their press releases about their opposition to the Medicare. And then about 8 months later, I think it was 8 months later, the Senate revisited the Medicare program, and it passed overwhelmingly. And the one great difference in that period of time was the election of 1964, when American people really gave focus and attention to the issue of Medicare and made the judgment and decision that we ought to go and move ahead. I've heard all of those arguments, a socialized medicine, government-controlled program. We heard that when this program was initially introduced, Senator Hatch, myself, and others, and we've heard those echoes time in and time out. But it was under the leadership of Senator Hatch that the judgment and decision in terms of providing the help and assistance to these children would not be a replication of the Medicaid program, but be a program that would be basically run by the states with an outline by the Congress about what would be included in terms of services. It was a program that was built upon the private companies in these various states. It was a program also that didn't quite match the range of different services that were in the Medicaid program, but nonetheless has been invaluable and in terms of these children. Mr. President, I come to the Senate floor today to speak about the health insurance, not the health insurance available to senators or members of the House or the President and his cabinet. As I was reminded again during my recent experience, we have access to excellent insurance to pay the cost of whatever care we need. Our health coverage is never in question. I speak of those who do not work in marbled halls or beneath vaulted ceilings, of those who work at the local bakery or the repair shop or make their living stocking shelves or cleaning offices. This debate is about our commitment to millions of American men and women who work hard every day, pay taxes, care for their children, but who stay awake at night worrying because they can't afford the cost of sudden illness. Used to be, when we debated this issue 10, 15, 20 years ago, we'd talk about the cost of an emergency room being $250 and wondering whether a child was $250 sick. That's the cost of going to an emergency room. And we used to debate about how do you measure the pain, the anxiety, the anguish that parent has, wondering whether their child is $250 sick, whether they'll get better tomorrow, whether that earache will expand or be an indicator of a more serious illness, or that throat ailment be the same, or whether that child will get better. Now it's $475 average across this country. Mr. President, that is what this children's health insurance debate is all about. Healthy lives for children, peace of mind for parents, Congress acting for the common good. CHIP isn't a Republican idea or a Democrat idea. It's not a state program or a federal initiative. It's not a public sector or private sector. It's all of those things and more. CHIP is an American success story. How much time do I have remaining, Mr. President?
18 and a half minutes.
What did you say? How much? Over the past decade, since it was first enacted, we have seen what it can do to transform young lives. Since then, the percentage of uninsured children has dropped from almost 23% in '97 to 14% in 2005. This is about a clear indication of what this program is really about, Mr. President. From just below 25% uninsured for children, this is 1997. Look where it is now, to 13%. What we'd see in another chart, if you talked about what has been the growth of the uninsured among adults, it would be just the opposite. It would be all going to the other way. This is a success story. There's an old saying familiar to every first-year law student: the law is against you, you pound the facts. If the facts are against you, you pound the law. If the law and the facts are against you, you pound the table. The President and his supporters in Congress have been pounding the table hard and often on this issue, and in recent months it's time to set the record straight. They have pounded the table about all the families making $83,000 a year who are supposedly eligible for CHIP. Let me tell you how many families making $83,000 a year are enrolled in CHIP. None. None in Massachusetts, none in New York, none in New Jersey, none in California, nowhere, zero. Not a single child in a family making $83,000 is eligible for CHIP. The new bill approved by the House last Thursday goes even further than current law. It makes it illegal to cover anyone in families making over $62,000 a year, or 300% of the poverty level. There it is, big black letters, page 75 of the bill. Denial of payments for children with effective family income that exceeds 300% of the poverty line. Now, according to the Congressional Research Service, 91% of the children covered by CHIP are in families with incomes below 200% of the poverty level, or $41,000 a year for a family of four. And almost all of the 9% of families above this level pay premiums to defray the cost of coverage for their children. That was a key part of the CHIP program. States will have a right to make judgments and decisions to be able to vary the premiums, the deductibles, and the co-pays. We let the states to do that for those that would benefit from the program at this particular level. The need for genuine outreach to more of the low-income children is a serious problem, but it's a foolish solution to address it by denying CHIP to children who also need it. Facts are stubborn things, and all the table pounding in the world can't change them. The basic fact of CHIP is that it began as a principled bipartisan compromise and remains so even now. Nevertheless, the White House has called upon the supporters of CHIP to compromise and compromise and compromise, and we have. But this much is clear. We will not compromise the future of a generation of American children just because they come from the working poor. Surely they are more important than multi-billion-dollar tax breaks for the wealthiest individuals or the largest corporations, and they are more important than the subsidies for big oil companies. They are more important than preserving the obscene tax breaks for the so-called carried interest. These are America's deserving children, Mr. President, and Democrats in Congress will stand up for them every time, and courageous Republicans will too. We have been more than willing to work with Republicans in Congress on reasonable and realistic compromises that still meet our obligations to these children. Many of us initially called for a much larger bill to properly serve the needs of the nation's children, but we accepted a less costly bill in order to obtain broad bipartisan support. Year after year, Mr. President, the administration has granted waivers to cover adults under SCHIP. As of February of this year, the administration had granted waivers to 14 states to cover adults through SCHIP. In August of 2002, they said yes to covering 40,000 adults in New Mexico. In October 2002, they said yes to 334,000 in Oregon. In January 2003, they said yes to 12,000 more adults in New Jersey. And in May of this year, amid statements from the President that SCHIP should put kids first, his administration said yes to 39,000 adults in Wisconsin. But now they want to say no. The White House is now shocked to discover that adults are covered under SCHIP. It actually cites the consequences of their own decisions as a failing of our proposal. The legislation the Senate approved last month reversed this policy by moving adults out of the program over the next 2 years. The bill now before us goes one step further. It moves childless adults from the program by the end of next year. But that's still not enough. Still not enough. The requirement that children produce onerous documentation, listen to this, Mr. President, to prove their citizenship has been shown to be a barrier to care for American children because they often had great difficulty meeting the burdensome requirements of the policy. These high barriers were imposed because of a fallacy, the myth that they prevented children in America illegally from using these services. Now, a recent letter from the Congressional Budget Office, not the Democratic office, not the Republican office, but the Congressional Budget Office, refutes that claim, saying available evidence based on state reports and other information provided by state officials suggests that virtually all of those who have been unable to provide the required documentation are U.S. citizens. That statement couldn't be clearer. It was American children eligible for CHIP or Medicaid who were denied services by these requirements, not the undocumented. The cost of this witch hunt has been high. According to a recent report by the Center on Budget and Policy Priorities, the 6 states that have examined this issue in detail spent $17 million to administer the requirement, have denied health insurance to tens of thousands of needy children and parents as a result, and have identified a great total of 8 undocumented individuals. The number of low-income children insured through Medicaid has dropped 11,000 in Virginia, 14,000 in Kansas due to the new requirements. Each state identified one applicant who incorrectly claimed to be a citizen. Even now, we accepted a compromise by requiring the Social Security Administration to verify the citizenship of any child seeking coverage under CHIP. The time has come to stand up and be counted, to see who is for the children's health insurance and who is against it. I'd ask the chair to let me know when I have 3 minutes.
The senator's time has expired.
Mr. President, I ask further proceedings that my complete statement be put in the record.